Assalamu alaikum, the communication day. Your role, you are the senior house officer in the medical unit. Scenario, Mrs. Sophia Alex. She's 65 years, known a case of COPD, admitted as COPD exacerbation. She was very sick on admission and unconscious. They signed her as DNR, do not attempt resuscitation. Son was agreed about the plan of management. However, now her condition is better, improved, regained her consciousness. Your task is to sit with her, tell her about the DNR decision to continue or not, and she is refusing the ABG. Also, please sit, explain to her the importance of the ABG and address other concerns. I'll adjust the timer, then you can start.
Okay.
Okay, here you go.
Okay. Hello, I am Dr. Ghanem, doctor in the medical ward. Are you Miss Sophie, 65 years old?
I am Sophia Alex, doctor.
Sophia Alex. Okay. Hello, Miss Sophia. Um, I'm here to discuss issues related to your health condition. Is it okay with you?
Yes, doctor. I'm waiting for
Oh,
you.
okay, okay. Can you please tell me how do you know about your condition so far?
I don't know, doctor. I came here with severe short of breath. I was not able even to breathe. I had history of lung disease. And I have also chronic cough. I had a lot of inhalers at home, and I came to the hospital many times for chest infection. And
Okay,
yes, last time I was not able at all, doctor, to breathe. I don't know what happened, doctor, after that.
okay, okay. So, what are your expectation about our meeting?
I'm not sure, doctor. I want just to be okay. I don't want to suffer, doctor.
Okay. Okay. Yes, Miss Sophia, you came here in this hospital because your condition was deteriorating, and as you know, yes, you have these attacks before because of this lung problem, which is the COPD. I think you know about it, right? Or you want me to explain?
No, doctor. I think your consultant explained a lot of this disease to me.
Okay, and you experienced a lot of attacks of it.
Yes.
Your condition last time, it was very, very serious, and you become deteriorated, and so you came to the hospital, and we admit you. And during this period, you become unconscious, and you not respond. You were not responding to any of the talks to you um, or anything. So we as a medical team decided to do the DNR. Do you know about it?
No, doctor. What do you mean by this?
Okay, the DNR is the don't attempt to resuscitate. Okay, this is the steps that we do if the person if the patient heartbeat stops. We started to give him like heart massage and giving him like medication to return his heart back um, to beat again. But in your condition and in the condition like like you are, we do not do these steps because it has risk for the patient more than benefit, and so we let the patient to die in peace. Are you with me till now?
Oh my God, doctor. Do you think will I die soon?
Okay. Okay, in situation like this, we may expect this situation can this serious health condition can shorten the patient life, and so we sign this as a protocol in our hospital, and fortunately you gained your conscious and you become better in better condition, and so we will not do this. What do you think?
Yeah, doctor. I don't want to suffer, doctor, but um, s- for how long, doctor, I can live?
Okay, this condition we will not end your life. We are not trying to end your life or let you die. We just if this happen because of the condition, we don't attempt to resuscitate or to help the person to regain his consciousness, because this will be um, more easy for him and not make him suffer. Okay, as your condition, we can no one can say how you will live, and it differs from person to person, and we will try to help you as much as we can, but this decision is done when the condition deteriorate. Okay.
Okay, doctor. Yes, I can understand you.
Okay, and we updated your son about this decision, and but as I told you, it is a medical team decision. It is done for the benefit, for the best interest of the patient, to not let him die, because this condition, this procedure, which is the DNR, the don't attempt to resuscitate, is has as it has benefit, which is the regaining of the conscious and regaining the heart to beat. It has also risk, and a lot of risk, and it depends on the condition of the patient. It needs the patient to be healthy to respond to this. Okay, Miss
So,
Sophia.
what hazards, doctor, I can
Yes.
face with this?
Yes, yes. Hazards, when the patient has deteriorated condition, like your condition, which is maybe the chest condition, the chest condition, or heart condition. He may have the fracture ribs, maybe may have also infection, can get infection. Also, we do use the electric shock that can cause burn on his skin. So for this DNR to be effective, uh, need the patient to be healthy, so he can bear what the procedure steps could happen to could do to him. Okay, are you with me?
Yeah, doctor. Okay. So, doctor,
Okay.
what
So
what
when
further, doctor?
decide
Yes.
okay, when decide this, it is the best interest for the patient. So when we say no, don't resuscitate, this for the best interest of the patient. Okay, so for now, we will give you all help that we can, and we have the team that was managing your condition, including the lung doctor and the specialized nurse and social workers. All can help you and give you the all the medications that you need. Okay. But about this decision, you may sign on it. It is your choice. You may sign on it or no, because your condition now is better. Okay. Okay,
Yes,
Miss
doctor.
Sophia. Okay. So for now, we need to check that your condition is okay. So we need to do some blood test. It is called the ABG. Do you know about it?
Yeah, doctor. I think so.
Okay, it is the arterial blood gas. We need to check the blood gases, or the amount of gases in your blood. I mean the oxygen and the CO2.
Yeah, doctor.
Okay.
I do it before. I told you, doctor, I had a lot of admission here, and they did it
Yes.
for me a lot. But
Okay.
you told me, doctor, I don't want also to suffer. It's very painful, doctor.
But it is needed to check your condition and to be sure that your condition has stabilized. This is very important for you. What is the problem?
Okay.
Why you don't want to do
It's
this?
painful, doctor. I feel pain while they are breaking me.
Okay, I'm so sorry for that. Okay, our expert nurses can help with this and can try to be gentle in taking the sample, but be sure that it is necessary for your condition. Okay, Miss Sophie,
Okay,
Miss
doctor.
Sophia.
Okay.
So, are you willing to do the test?
Okay, doctor. It's okay if I will not suffer and have pain. I agree.
They will try to be gentle and be sure it is important for your
Okay.
condition. Okay.
Okay.
Okay. Okay. So, you have any other concern?
No, doctor.
Okay, so I will give you some leaflets and brochure to read about the don't resuscitate the DNR. Okay, and to know the risk and the benefit of this. And if you want any help, we are here for you. And you can ask us at any time. Okay.
Okay, doctor. Thank you. Time is up.
Okay.
Thank you, doctor. Well done. Actually, this scenario, I read it from the recalls in UAE. It
Mm.
was, I think, the last year. Also, the scenario is not clear, but I try to modulate and manipulate it to make it as a communication scenario in the exam. If someone knows about the scenario detailed, exact one, so he can share with us any experience with this scenario before. But for meanwhile, let's comment about this performance for Dr. Sar. The introduction and as usual the knowledge about the condition, the expectation, all are good. And the point of explaining the disease, yes, no need because already she knows everything. But the complication, again, you have to tell her what the possible complication for the COPD. And from this point, you can explain the DNR. I don't want you to go through all this because you had chest infection before. You had a lot of admission. Yes, we don't want you to suffer. How to prepare for DNR? You give me the DNR like a diagnosis. It was not a diagnosis approach. Okay,
Mm.
you
Yes.
have to prepare me for the DNR. Then, according to your condition and situation, and we don't want you to suffer, we will not do this DNR and explain the DNR now. So you have to prepare me, then explain. What the DNR now you can say it's a procedure when your heart stopped or before a stop, we can go to or jump to your chest to do some heart massage. We don't want you to be suffer from this procedure. Your bone will be broken, not your ribs. Okay, ribs are jargon. This is a jargon, so you can say your bones or your chest bones will be broken. You will be having a lot of bleeding from your lungs, and you will not get any benefit from it. And the quality of life after that, it will not be that much as you expect or anyone expect. Simply, this is what the DNR or do not attempt the resuscitation. Okay. For
Okay.
what for that, yeah, we spoke already with your son, and we give him the all information needed. And your condition was critical when you came, and this also let us or our consultant made the decision for this condition. I'm so sorry for that. Will I die? Yes, as you said, we differ from person to person, and I'm afraid it might be maybe weeks, maximum months. Why? What do you think if she had COPD exacerbation again? What can improve her condition? The CO2 is high and she will have respiratory arrest or respiratory failure, then respiratory arrest. The only thing can help her to be okay, back to normal, the intubation and ventilation. But since you will do this procedure, you will not do the intubation, of course. Of course, the DNR, you have to inform also about the tube. Yeah, we have to put tube in your throat, and these tubes will be connected to machines. This is one also from the steps of DNR. And of course, the resuscitation. We will not do resuscitation without intubation, so you have to explain also the intubation. For that, the tubes will not be inserted in order not to harm also or to hurt you or your feeling or let you put you at under risk of any infection, feeling pain. We don't want you to suffer, and your quality of life will be with no value if we do the resuscitation or if we do the heart massage. Okay,
Okay.
this is regarding the first part of scenario, which is DNR.
هو شرقان جاي لي طلع بلاش الأصوات.
Okay,
Okay.
the other part, which is the ABG. I don't know why ABG if patient signed DNR, but it was written in the scenario. Let's assume the ABG is important. Yes, to know the baseline of the patient. So we can either convince, this is my opinion, I didn't face this scenario before, but if the patient refuse and it was painful, so the alternative, it will not be arterial. We can do venous, just to to know about the level of hair bicarb or sorry BCO2, which is toxin or toxic gas in your blood, in order to know what's your condition or baseline of your condition. But if she refused and she already put her DNR, why would to insist and to convince her? This is my opinion. And anyone has feedback about this scenario, please he can share with us.
Yes,
Because I
Dr.
use this
Bassem,
scenario. Yes.
I know this scenario.
You know
I am.
every scenario, Dr.
Yes, yes,
Mahmoud.
yes. I know this scenario very
ما
well.
شاء الله عليك. يلا tell me, give me يلا feedback.
Yes, doctor. I am in the war now. Okay, this scenario, Dr. Bassem, is a quality of life. You will guide by the patient, by the surrogate. You will guide by him. First, you will ask him. You will tell him, "So I am happy to be improved," and then you will discuss with him the quality of life of the patient. About what about your daily activity? Are you able to go around? Are you able to go shopping before admission in the hospital? And also ask him about if any hospital admission, any history of breathing machine. After that, after assess quality of his quality of life, the patient, the surrogate himself will tell you, yes, doctor, I bought in the breathing machine, and please, if I need this breathing machine again, don't put me in the breathing machine. And the other thing, the surrogate will tell you, okay, doctor, please do anything to help me. Okay, we will revise with the consultant about the decision of the DNR. So you will guide it by the surrogate. If the surrogate tell you, yes, doctor, I have a bad quality of life, and also I have many hospital admission. I was put in breathing machine once, and it was a bad experience. The patient, the surrogate himself will tell you, yes, doctor, I am accept to this DNR. If I worsen by the bad asthma, by the way, COPD is jargon, so it is bad asthma. If I have any bad asthma exacerbation, please don't put me in the breathing machine. So it is this case is a quality of life. You should ask the patient about his quality of life before hospital admission. After that, if the patient refuse, okay, this decision is a decision of treating team, and we will assess
Yeah.
have any.
So she will be prepared for DNR, but anyway, the decision will be delivered
Yes,
to the patient.
but Dr. Bassem, you have to be يعني share this thinking with the surrogate.
Yes, I said this, Dr. Mahmoud. I said you have to ask him about the previous suffer and how much he suffered before,
Yes,
and yeah, about his quality. Yes, I said it as a question, but you want me to make it as a share, right? A quiz
Yes.
share.
What is before admission? What is your quality of life? Are you able to go around? Are you able to go shopping? Are you on oxygen in the home? Any hospital admission
Okay,
before?
but it will not be considered as history taking. Also, this is another point.
No, doctor. No, it is communication, like suicide, functional disorder, like IBS. It is communication. I will communicate with the patient. What is
Okay,
your
about
quality of life?
social, yes.
Yes, it is quality of life.
Okay,
It is the main communication.
okay.
Uh,
And the ABG point.
ABG, yes, there is many options. We will discuss with our team. There is also a tube which fix in your blood channel. We can take the samples from it. It is arterial line. We can insert it, but we will assess you if you need many gas
Samples.
mini samples. We will discuss with the team about insert a tube in your blood channel. It will be safe. It will be covered by socks or anything like
Okay.
that. It is the option here. But the scenario, Dr. Basim, really it is a scenario of discussing about the quality of life of the patient. What is
I
your
think
quality
yes,
of life?
it's conversation scenario. So you have listen from the patient, and you will reply on his words.
He will lead you.
Yes, of course.
He will lead you where
He will
the
guide you.
scenario.
Yes,
He will
he will
guide you.
guide you.
Yes.
Yes, yes.
He will guide you where the scenario
I agree.
going on.
Agree.
He
Yes,
will
I
be
agree.
angry if doctor put DNAR. Not angry. Patient will accept. Patient
Yes,
even he put in the breathing machine. It is bad experience for any patient to put in
yes.
breathing machine. So he will tell you, yes, I accept
Mm.
doctor to
Yes.
put. Yes.
Yeah, yeah. It was also one of the words when I said to her, I don't want to suffer again. So
Yes.
patient already suffered, and she doesn't want to be suffered again in
Yes,
her.
Dr. Bass.
Yes,
You will guide by the surrogate. The surrogate will guide you. Just
yeah,
share with the surrogate anything.
yes. Okay,
Mhm.
okay. Thank you, Dr. Mahmoud. Any comments?
Thank you, doctor.
Thank you much.
But
Thank
I
you so
think
much.
this case come in the Egypt in the diet too. That is patient admitted as ICU because COPD exacerbation and the patient for DNR and then the patient is recovered again and today come for as OPD and discuss with him the issue of ceiling of care.
Okay,
Uh,
so end of life, you mean end of life care?
Yes.
Yes.
I think,
Ceiling
Dr. Bassem, it is difference between seeding and end of life. I think it is difference,
ceiling
but
of
I
care
don't.
mean
Healing usually is the top يعني the last step you will approach while managing a patient. فلو اخترت السيلينج if you choose the ceiling is end of life you will do only end of life support. Sometimes the ceiling can be to support the patient up to ventilation, to support the patient
Yes.
up to dialysis. end of life is one type of ceiling of care. يعني أنا لأي سقف حضل عم بدعم هذا البيشنت. هل حأدعمه لحد ما وصل للميكانيكال؟ هل حأدعمه لحد ما وصل للميكانيكال والإينوتروب؟ هل حأدعمه لحد ما وصل للميكانيكال والإينوتروب والدياليسيس؟ ولا لا بس حأدعمه بآي في فلويد وبين كيلرز فهذا اسمه السيلينج اوف كير. this is also interesting scenario about the
Yes, Dr. Ali, yes. Is sealing in the ward, not in ICU.
Okay,
because
so the maximum
it is
support in a ward, yes.
in the
Okay.
ward, yes. But I think Dr. Hind, not
why only
machine.
in the word لا
Yes,
السيلينج of
the mean.
care is covering everything.
No, I am
أنت
sure
عندك
about that.
السيلينج can be escalated up to the high dependency unit, up to mechanical ventilation. So when you determine the ceiling of care, it's not only in the ward. You will determine whether you will escalate this patient to the high dependency unit, whether you will provide him يعني how much support you will provide him. لأي درجة أنت محدد إنك تعطيه لهذا البيشنت أو هو يستحق على حسب الكيس تبعه. بس ما بتذكر إنه هو بس حكر على الوارد patient.
I am sure, Dr. Hind, sealing in the ward only. Yes, I'm sure.
I listen,
then
Dr. Hind, how are you? I listen from Dr. Abbas, wallahi. I listen from many tutor. This ceiling care usually we doing for patient he has advanced disease like COPD, like cancer, like this, and usually not involve ICU. usually doing this ceiling care
Yes.
in the ward. In the
يعني
ward.
أنتوا قصدكم إنه patient خلاص decided end of care, end of life؟
Yes.
شو الفرق معناتها
The
بين
first
end of
difference.
life والceiling of care؟
Yes, it is a must. If this scenario يعني told this ceiling, you must tell the patient you will have all support but in the ward, not in ICU. That is the
هي ما
one.
فيش حاجة اسمها سيلينج ما فيش يعني في ماشي مصطلح اسمه do not resuscitate. I will say in English there is a terminology said end of life, terminology do not resuscitate. There is no terminology calling sealing. You can say it's a reward. You can say sealing of care of the patient word in the word by giving IV fluids, but sealing doesn't mean anything. It's normal word. It's not medical term here. You can say I will seal sealing the care of the patient to IV fluids or only an antibiotic. Word sealing, and you can add word sealing. So when we seal the care to the ward, it means that the patient will have to the ward. But it's not a medical terminology or anything. It's normal phrase.
هي صح بتشمل كل اللي أنت قلتيه. يعني
But if you
يعني
say
it
sealing
is
only, if you say only the word sealing, it doesn't mean that it means that it will be word
it is not a type of care. يعني أنا بعد ما
Yes,
after
it's
I will
nothing.
say this phrase I have to determine 1 2 3 4 what I will do to the patient.
Yes.
it is not it is not type of care. بس هي فعلا كانت مذكورة بالسيناريو وإنه يعني the team has determined or discussed the ceiling of care with the relative.
Yes, but when
لكن
you
كونوا عم
decide,
بتقولوا إنه it's only for the end of life and in the patient who are already in the ward we decide not to escalate for high dependency unit. This والله يعني this is the only new thing for
we'll say word-based sealing of care. And we'll take antibiotic, IV fluids, non-invasive ventilation. What exactly we'll do for the patient.
Okay,
The
I
word
Google
sealing
it.
doesn't have any meaning. Okay, it can be added to sealing to the word, so it will be word-based care. Okay.
Can you please, doctor, repeat again the scenario? How was the scenario in which mentioned sealing of care? How was the scenario?
It wasn't here, Dr. Najla. It wasn't in this scenario.
Yeah,
Maybe
yeah,
it was written in another scenario.
Yeah. He mentioned
You
it.
want
I
from
just
the one
want,
who mentioned? Okay.
yeah.
The
I
one
just
who
wanted to
Yeah.
to know how it occurred, like how they mentioned this word.
Yes, the scenario came like this, as Dr. Basim said, but the patient is after recovery. Today came the OBD and discuss with him sealing of care. حتى مكتوب إنه مكتوب في the written in the background of paper على البوكس بتاع diagnosis of sealing of care.
So
it
the
was a
patient was
task.
on do not resuscitate, and then he recovered.
Yes,
And now you want to discuss with him.
sealing of care. And
sorry,
how the patient it is already signed DNR issue, and today discuss with him sealing of care. And Dr. Hind says that the sealing of care to provide the patient everything about the care.
If I can say something, please. Sealing of care, that what much you can offer the patient. Dr. Mahmoud is correct and is right. It
Yeah.
does not mean that the patient go to the ICU. Once he is in the ICU, that means everything can be provided. Sealing of care, that he will not get things in the ICU, and he is not end of life. So sealing of care, some patients you put a sealing of care in the ward, okay, or for example in HDU, but not ICU. And after that, the patient can go home and continue his life, and even it can come admit again, okay. And there is be sealing of care, for example, no intubation, no like that. So he will not go for it. Is not an end of life by all means, okay, but it is limitation of what you provide the patient. So big difference. It is completely right that sealing of care, that means the patient will not go for ICU, cannot make sealing of care, for example, to give any drops or sealing of care to anything can be done in the ICU. It is something different. So sealing of care, that how much you can offer the patient.
Yes, I also Google it and I share it to the chat box. Sealing
Up to what, Doctor?
effects.
Yes.
Okay, I will read this only. Okay, go ahead, doctor. Up to what?
Yes. Up to what to give the patient care regarding this sealing of care.
Yes,
Up to
in
مثلا bypass,
the
something
word
like that, oxygen therapy.
Yes,
how
yes, you can give
how to
oxygen
provide
therapy,
ventilation.
you can give
I,
antibiotics, you can give non-invasive ventilation, you can give many things, okay, in the world. But
Yes,
but no invasive.
this is, yes, so it will
everything,
be,
but no
it
ICU.
will, yes, no
Yes.
ICU. It will be clear
Yes.
for the staff if this patient you give, for example, non-invasive ventilation and he improves, that is good, he can go home. But even if he deteriorates and he needs intubation, it is clear that the ceiling of care, no intubation. So it is
No
only
intubation.
just to a mark, a line that you cannot go beyond that one.
Yes, I think
Yeah.
yeah, the meaning here also in Google, I Google it in the chat box, you can read. It's a ceiling in medicine and pharmacology refers to the phenomena in which a drug reach a maximum effect so that increasing the dosage doesn't increase its effectiveness. So you reach to a level you cannot provide beyond this level. As I think the same meaning all of you explain, but where we are, this is the conflict now, where to offer or to provide this.
دكتور باسم أنا
Yes.
برضه دلوقتي أهي ceiling you can
Okay.
ceiling of care include whenever or not patient admitted in ITU. Ceiling of care is meaning the maximum care. It's only a word, and you
Yeah,
explaining
yeah, yeah. No need. Yes, I agree for that because he will not get benefit from increasing or adding more. That's why you reach to the
It
maximum.
depend دكتور باسم، عم تحكي عن ceiling of care for a palliative patient ولا ceiling of care for patient بتتذكر الستيفن جونسون syndrome case which was sick organ failure but she was young. فأنت هاي ceiling care for her is maximum support، بس ceiling
Yes.
care for patient who are advanced cancer وهي exhausted all حيكون لا end of life. ceiling of care هو سقف السبورت يلي تتفق فيه أنت والتيم مع الفاميلي إنه this is gonna be offered. فأنا لو إجي لعندي الهازبند of the ستيفن جونسون وقال لي أنت you will support my wife، حلو طبعا maximally ICU dialysis إذا تعبت الكدني تبعها، she's young she deserve no comorbidity، فححط لها high ceiling of care. لكن لو اجى لعندي الريلاتيف تبع الادفانس كانسر وسالني قال لي شو السيلينج اوف كير تبعك، حقول له والله وارد بيست ولا بالياتيف كير بيست. فالسيلينج اوف كير ديبند على السيناريو تبعك. فانت I agree with you if it was a palliative care scenario, if it was the Stephen Johnson scenario, if it was a young, if it was an elderly. والكاتيجوريز 3 لان هنا متذكره انتم
Yes,
فاجأتوني
yes,
حكيتوا.
doctor. Yes, doctor. And three categories: full escalation and ward-based care and palliative care.
فالسيناريو اللي اجى فيه السيلينج اوف كير كان على ادفانس، فحنختار الثيرد كاتيجوري. بس لو اجاك ستيفن جونسون كانت كمان تعبانه بس they offered her everything because she's young and no comorbidity. يعني I hope you get me. فالسيلينج
Yes.
اوف
Yes.
كير
According
is
to
a
the
very
condition.
general term.
So
حدث ان جاء بسيناريو palliative.
okay, you mean case by case and yeah.
Yes, yes.
If you just reviewed what I sent in the chat box, it depends about the medical team, like the appropriate intervention deemed by the medical team, aligned with the patient and family wishes, values, and beliefs. So it's just discussing with the patient what we can offer to them. What is the maximum thing can be offered in their condition. It's not about like providing false hopes or things that we cannot offer or anything. It's just like the medical condition. The maximum things that we can provide in this situation is 1 2 3 4 5 and agree for it, and that is ceiling of care as I understand.
Okay, the good thing in this scenario, the conflict here make us clarify this point more. I think most of us doesn't know before about this ceiling of care. I think it's clear now for most of us. Started by the support and the maximum support, and I agree it will be depend upon the type of diagnosis and the type of the case. So it will not be specific or general rule for all patients. It will be variable from patient to patient and from case to case.
And I think Dr. Bassem in the scenario he will tell you which type of ceiling care, because the scenario came in Egypt is ward-based ceiling care. It is one of the categories of ceiling of care. But there is another categories like full escalation and palliative care also. Palliative care is apart from ceiling care.
Yeah, clear now, clear. I think it's clear.
It will be guided in the scenario.
Yes,
It will
according
be,
to the scenario, yes, it will be
yes.
a scenario.
والage والcomorbidity
Of course, yes, yes.
diagnosis, all of them will be consistent. يعني أنا لو شفت elderly وقال لك COPD وقال لك advanced cancer وقال لك he had multiple admissions with CPAP، فلما حقارأ أنا إنه determine with him the ceiling of care، أنا already عرفانة إنه الكيسز advanced، فأنا أي كاتيجوري حأختار. ولو كاتب الكاتيجوري palliative care أو كتب لك كلمة word based أو كتب لك DNR، it will help you further to determine the ceiling of care يلي حطه التيم واللي بدهم إياك تحكي عنه. تمام؟
Yeah, clear, Dr. Hind. I think also we learn from this the scenario that the clear scenario, straightforward scenarios, we don't learn from it compared to this scenario. This scenario, a lot of debate and conflict, and we learn a lot from it. Okay, back to the assessment and evaluation for Dr. Sarah performance. Let's go from the clinical communication. I think, yeah, you can get the full mark, satisfactory. And anyone has suggestion he can add, especially Dr. Mahmoud, because always he is minusing. So,
Yes, Dr. Jargon, many jargons.
okay, borderline. Thank you for
Yes.
reminding.
Yes.
Thank you. Okay, you'll be examiner after your exam. You will be examiner with us, and you will be the one judging on our performance.
Thank you, Dr. Base.
نصيحة على موضوع الجارجونز. أنت لما بتقول أي كلمة لا تعديها. نحن كتير صرنا يعني نيأس إنه خلص أنا قلت الكلمة ما عاد صلحها.
Yes, you can
مجرد
correct
ما
it.
تتذكر، صدقوني بتنفع كتير. مجرد ما تتذكر حتى لو بأثر رجعي، يعني أنت قلت كلمة stomach طيب، أو قلت كلمة abdomen عادي، إلا and I have mentioned this word before and it mean كذا كذا.
Yes, exactly.
حترحمك كتير، بالذات إذا الإكزامينر متعاون. عادي نحن بنغلط وستريسد، ويمكن it's our first time we did not practice too much. Whenever you remember that you mentioned a word, just apologize at that time. Correct the meaning, draw something, make it clear and continue. Don't make it something يعني big issue for you.
Yes, yes. It will
عادي
affect.
عادي، لأنه لا تنسى it is again and يعني it's again like kind of acting. if you are a good actor حتشفع لك.
Yes, yes.
بس اعتذر. I'm sorry, it seems that I was mentioning a medical terminology word, it mean this and this، continue. والله بالعكس يمكن يحترموك أكتر، لأنه you found a way to rectify yourself. You find a way to correct something which sometimes cause others to fail. فتراي خلص عادي، مجرد تذكرت، مجرد قلتها، just correct yourself.
You
Okay,
said
Dr. Hind, stomach is a food bag? Food bag, yes?
food bag، هن
yes,
بيحبوا
food
food
bag.
bag which we call. بس لو كنت بيوكي لا تقول food bag.
No, I am in Egypt.
Stomach, yes,
Don't
they
worry.
know what is the stomach. And believe me, إذا أنت بيوكي, anyone in UK, just ask the surrogate, do you know what is the meaning of stomach? هيقول لك yes, خلاص continue stomach. حتى ما بيحبوا كلمة back passage. شو back passage؟ بيلاقوها كتير غريبة. ممكن يقول لك what is the waterwork, what is the back passage. الكوندوي ما بستعملها، يعني ممكن ما يفهم عليك لو حكيت هالكلمات. فتراي إنك to tell him, do you know what is the stomach, do you know what is the gullet. ما تستعمل food pipe، اسمه gullet. تمام.
What you are mentioning
يعني
are jargons for them.
yes, food bag, food bag. It will be a jargon for them. You are totally right. So if you are in UK, ask him, do you know what is the stomach? And if you know it,
Yes.
continue with the stomach.
Yeah. Yes.
Dr. Basim, a small comment.
Yes, sure.
She did very well, but when she discussed with the patient about DNAR, she offered her that after you understand what I say about the DNR, you to sign that one. There is no signature in the DNR. It is only a matter of discussion
No,
between
she
the
was
head.
discussing this signature about approval for ABG, not DNR.
Even ABG, there is no signature for approval for ABG. ABG process, you will tell the patient, I will do that. It is there is no the signature is the consent in other things. ABG has no
No, she
signature.
didn't
Doctor,
say
I didn't
signature.
say
She said,
any
yeah.
signature. I
She
asked
said
for
if you
agreement
agree,
only.
yeah, if you agree for the sampling,
Agreement.
yeah, agreement for the sampling. And
Uh,
again, because it's harming the patient, you can ask her if you agree. Okay, if not, it's okay also, because this patient right to have a treat or no. And
no,
this is
maybe I was hallucinating, but
no, no, no,
it,
no,
it
no,
was
no. It's
said.
okay.
No, no,
No,
no.
no.
It is
Thank
all
you for
right.
the comment.
No, it
Thank
is
you.
good. It is all right. But what I say, and I can review it later in the recording. She said to sign.
Yes.
No, no, no.
No problem.
To
Okay.
I'm sure she said if you agree, okay, we can do it for you. Okay.
Sign. I am sure, but no problem. Once we agree all for that, that is okay. That is great.
It's okay if you can listen again and confirm. No
Yeah.
problem, doctor. Thank you,
Okay.
Dr.
Thank you.
Muhammad, for
Thank
the
you.
share.
Thank
Thank
you.
you. Walaikum assalam, Dr. Azhar. Go ahead. Yes, please.
Dr. Mahmood, I'm still confused about the scenario. As you know the scenario very well, it's written in the first part that it was signed DNAR. So it was
Yes.
signed by the patient or by the
Yes,
treating
no,
team?
treating team, sure, treating team. Patient not signed DNR.
Okay, okay. In the second part, we have to sit with the patient
Yes,
and we will
Comm
have to
also,
explain the pros and
She
cons of the
wasn't
DNAR.
she wasn't conscious when they signed DNR.
yes,
And now
uh,
she's conscious, and you have to talk the DNR about with her.
Whether she agrees or not for the DNA.
no,
Not agree. She will be. It's a medical decision. Just to inform her.
I think Dr. Azhar, in this scenario, the patient will tell you, yes, doctor, I have
Yes, I don't want to suffer.
admitted, admitted previous with breathing machine, and I don't want to suffer again.
Exactly.
I
Yes.
think that the scenario.
Yes, yes, this is the one. Yes, yes, you're right.
Mm.
And this is the introduction. I told her I had a lot of admission. I don't want to suffer, because it's very painful to and hard to suffer all this for nothing. Patient
Yes,
knows the
you know,
outcome.
Dr. Bassem, yes, because it will differ from doctor to doctor to how to communicate with the patient. And it is
Yes, yes.
the main
Always,
Mm.
yeah, always be listener and see what she will tell you, and according to that, you can reply. This is
Yes,
the advice. Whatever the scenario, when you sit with the surrogate, listen to him, listen to her, see what she's saying, and accordingly, you can give her the answer and address the concern, either
yes.
to convince or to
Not
accept.
not give him orders. Just
Yes,
let him say. He will tell you everything. Really,
yes,
he will tell
exactly.
you.
Yes, yes, you're right. Yes, unless the angry person, this one you have to calm
Yes.
yourself, really, and to wait for her calm. When she is calm, or either to convince her about your plan or your management or your news or whatsoever.
The aim here, Dr. Basim, is how to calm this angry from the start.
You can,
يعني,
you can. Yes,
yes,
it's instructed. She's instructed to be.
yes,
And don't worry if she stayed till the end angry. Maybe this is also her job or her task, to be like
yes.
that and to stress on you more and more and to put you under pressure and to test how you can tolerate all of this. So no worries
What
about
I
it.
understood
Yes.
is,
Yeah.
what I understood is that patient has no right to demand for a treatment. He can
Yes, of
only
course. Yes.
accept.
Yes.
He can only accept or refuse for a treatment. He has
Yes.
no right to demand that
Yeah.
please you have to do the cardiac massage for me. He has no right.
No, no,
He
no.
can
She will not
only
ask.
accept or refuse.
Yeah, she will not ask. Yes, she will not ask.
Okay,
Okay, clear. Okay,
clear.
back to the evaluation, Dr. Sarah. So borderline the clinical communication. What about judgment, Dr. Mahmoud?
Judgment, he didn't tell me about my quality of life. What if I suffered before hospital admission?
Okay,
I
so
was
again,
suffering. I have had asthma and suffering before hospital admission.
but the decision as a medical decision, she deliver and she give her the information. But the
Yes, but I
complication,
think
yeah, supposed
Dr.
to tell more.
Sarah,
Yes.
يعني in scenario HIV, she was very sad about the nurse which is HIV. In this
Mm-hmm.
scenario, no يعني
Sympathy, you mean, and empathy? This is for the clinical
yes, no
communication.
empathy. Yes, there's no empathy
Clinical communication
in this scenario.
and welfare. Okay, so the welfare, the clinical judgment will be borderline.
Doctor, because Dr. Sarah is good in communication. She is يعني
No,
professor
it's
in
by the
communication,
way,
really.
it's up and down day and day. And in the
Yes,
exam, hopefully we will be all of us up. And also another exam you might be down. It's luck. Okay, it's
هذا الكلام اللي عم بتقوله كلام جدا جدا مزبوط.
exactly
ما
yes.
في حدا يعني أنا قديش بالكوميونيكيشن بحس إنه أحيانا أوكي صرنا بنعرف كل السيناريو،
Yes, but still
لكن بيطلع لك
yes,
سيرفيت بأخلاق معينة،
yes,
بيطلع لك
exactly.
اكزامينر بستاندرد معين،
Yes.
بيطلع لك سيناريو بسطر معلومة مخفية وهيدن تاسك، بيعدم عليك خبرتك كلياتها.
Yes, Dr. Hind, you know the
وهيك
scenario came in Egypt last diet. Many doctors feel about it. It is a scenario of digoxin. You know this scenario?
yes I know it. البيشنت اللي
Digoxin.
عطوه ديجوكسن وبعدين توفى
Yes.
هيك.
Yes. Yes.
Okay, any scenario,
Uh,
Dr. Mahmoud, you can send it and please
yes, this scenario, what is the aim in this scenario, Dr. Hind?
to practice it.
خلاص أنا ما بقدر أكسر كلمة دكتور باسم.
Okay, Dr. Basim. Okay, I will prepare this scenario.
Yeah,
Let's
just
go.
send it to me. Just send
the
it to
aim
me.
of the scenario يعني شوف أنت بس اللهجة قال
Yes.
لك يعني لا تحكوا عنه خلاص.
Yes, this scenario
خلاص يا
tricky.
سيدي بنعمل له براكتس ولا يهمك.
Yes.
we can really do it لأنه it was a nice scenario, it was a new idea.
Yes.
better not to ruin out the ideas of the scenario.
Okay. So we can do it another day. Yeah.
بإذن الله.
So the welfare and the concern, Dr. Mahmoud, same, right? Satisfactory. She didn't affect the welfare and the concern, right?
But concern ABG, about ABG.
Yeah, she convinced and she asked.
No solution.
You
Okay,
mean the
Dr. Basim.
arterial line?
Yes, this is arterial line. This is the best option, the best choice for this patient.
But how you are doing DNR and withdrawal, then you want to insert arterial line for him.
Yes, I think Dr. Basim, now the patient will be signed from DNR. I think that.
I don't think
I
she
think
will be candidate for
patient
arterial line.
improved. It is according to
هلا شوفوا أنا حقلكم شغلة بس حتى تتذكروا إنه دائما
But it's a
DNR is a reversible decision. فإذا أنتوا هون هذا السيناريو نحن ما بنعرف فيها how much she improved. إذا كان مكتوب إنه she will be discharged و she improved ما لازم نستغرب نحن إنه there is a possibility إنه really they reversed the DNR. وإذا بتتذكروا مرة استعملوا كلمة amper pathway. كانت الفكرة من amper pathway إنه some cases they deteriorate, we think either they will come out of this deterioration saved وحنبعتهم على الهوم أو حيطلعوا على المقبرة فورا، سامحوني بالكلمة. فamper pathway it was a pathway where a temporary where we keep the patient under this bundle for like let's say short period 24 hour until we decide finally هل البيشنت is deteriorating ولا لا الحمد لله he start to recover. always the DNR is a reversible decision. you might find something very clear in your card إنه الحمد لله هي تحسنت وهلا she will go back ماما بس تمام أو she will worsen يعني.
okay.
تمام.
So it will depend on the scenario. Okay, thank you, Doctor. Dr. Sarah, you can send a new scenario, the other scenario. Okay.
Okay,
Are you
in the group. In the
the
group.
group? Okay. Dr. Ali, I think Dr. Ali Sadiq with us. Welcome back to the session, Dr. Ali. A long time you didn't join.
Sorry, where is the bed of this patient? This one.
The edge in here, halfway down.
Yeah,
On the
okay,
left.
Dr. Abbas, thank you والله.
Okay. I will read the scenario for. I think there is a lot of comments. Sorry, Dr. Ali. I think there is. You can.
Dr. Sarah, Dr. Basim, always like angry patient, angry son.
Okay, where is the scenario?
Yes. Angry.
Yes. She sent it here.
In the group WhatsApp, Dr. Basim. Okay,
Yes,
I will
okay.
send. I will send.
Yeah, because a lot of message, but there is, yeah, here it is. A senior house officer in the medical ward, Mr. David, 60 years old, known case of achalasia, history of repeated esophageal balloon dilatation. This time he developed esophageal perforation. During the procedure, this complication can happen in about 5% of patients. The patient has consented to ask to talk to his son, talk to angry son, Mr. John, and address his concern. Okay. We can start after this scenario. I will read the comments. You print. Okay, you brought it. Thank you, Dr. Mahmoud. Ready, Dr. Sarah?
Okay.
Okay. Hello, Dr. Mukhtar, the doctor in the ward today. You must be Mr. John,
Yes, doctor.
and you are the son of Mr. David.
Yes, doctor.
He is 60 years,
Yes.
and you are the next of kin for him.
Yes.
Okay, we are here after permission from Mr. David to talk about his condition. Is that okay for you?
Okay.
And can you tell me what do you know so far about Mr. David's condition?
Okay. My father admitted to the hospital because he do this dilatation operation. He do it a lot of times, but now they told me that there are complication happened. I need to know what happened.
Yeah, I appreciate your concern, your worry, Mr. John. What do you think? What's ongoing, Mr. John? Do you have any
I
idea?
don't know. He always do this operation, and he come home, and it nothing happened. Now there are some complication, and he need to stay in the hospital. I need to know why.
Yeah, I appreciate your worry again, and thank you for sharing with me what you know about Mr. David. And I can explain to you what happened exactly during the last procedure. As you know, Mr. John, um, the procedure done for your father was about to make widening and make some change in the narrow area in his food pipe to make it bigger as it was before narrow and very tight. You know that, right?
Yes, I know that.
Yeah, so with the last trial, while we are trying to make it bigger, this narrow gate at the end of the food pipe, some complication happened, unwanted effect or unwanted things happened.
Yes, I know. What is it?
Yes, I agree. I appreciate your worry, Mr. John. It was injury to the wall of this food pipe.
What?
Yes,
What is this? How is that happen?
it's called perforation. Have you ever heard about that?
No, doctor.
Okay, so while we are trying to do the dilatation or what's called widening or making this narrowing or tight gate bigger, sometimes due to passage of our camera and our tube, because of the passage, some complication might happen, and it's unintentionally at all. And we had the action immediately. Are you following me?
Oh, yes, why this happened this time?
Yeah. Actually, Mr. John, I appreciate your concern. Because of multiple trial of dilatation and the procedure before, sometimes this area become more weaker than before. And once you touch it, it might lead to this perforation. For that, we aborted the surgery. We pulled out and we removed the tube and the camera out of his food pipe, and we called the surgeon and the surgery doctor to be attend to see what can be offered to Mr. David. Are you following me?
Yes, doctor, and this is serious, right?
Yes, I appreciate your concern, Mr. John. It's one of the serious complications. However, it's very few, and it's not usually happened, as we are expert in this procedure. However, we will follow up your father, Mr. David, and we'll put him under monitoring and under our eyes as a follow up. We will monitor this area and
How
we
serious is the condition?
It's serious if untreated or if it increased in the
I mean,
diameter.
what could happen
Yes,
before after
I,
this?
I appreciate your consent.
Mm.
Sometimes this food pipes in the chest, sometimes it's beside the heart or the lungs, which is the area for pumping of the blood, and the lungs also for the breathing. If this happen, the food might go there and it might lead to some infection in serious areas like the heart and the lungs. For that, we have to keep him MPO. I mean, nothing per oral. It means that he will not take anything per his mouth, and he will be monitored for a long time, and he will take the food through his blood channel. Are you following me?
How is that he will starve?
I appreciate your concern. It will not be starving as we are giving him some of this feeding through the blood channel. He will not feel hungry as long as he's taking this fluid through his blood channel.
Okay, does my father know about this?
Actually, he had signed a consent before the surgery. We explain and we address all these complications to him, and we give him the possibility for each complication. And finally, he signed the consent when he was okay, and he was also fully aware and he was knowing everything about this procedure.
And now he isn't. He know that after the procedure.
I appreciate your concern. We just finished the procedure and we just sent him to the high dependency
Okay,
unit.
please don't tell him. Please don't tell him.
I appreciate your worry and your concern, Mr. John. Our responsibility and our duty always to inform the patient about everything. He has the right to know and to share with us the plan and the management and also to do the diagnosis and the condition. I'm so sorry for that.
He will be shocked.
I appreciate your worry again, Mr. John, but be sure that we are here for his care and to support him. And also, we have expert and professional person who can deliver this information to him without hurting him. So don't worry about that. We will take care about this area, and we will be calm with him, and we'll try to convince him about this.
Okay, I need to take my father from the hospital.
Yeah, I appreciate your worry again. It's not now, Mr. John. I'm so sorry to say that. I'm afraid to say it. It's the condition now is not suitable enough to take him home, and he must be treated in the high dependency unit to receive some medication and also to be observed for any complication might happen. How does that
Okay,
sound for you?
for how long he will stay?
We will follow up him day after day, and we will update the plan and the management with you whenever anything will happen. We will let you know.
Okay, for how long? Okay, he will stay.
Yeah, it might be for a few days up to weeks. We don't know how much this will heal. This perforation will heal, and we will follow up with him with the multiple doctors. They are specialists and they are professional in this. How does that sound for you?
Okay, doctor.
Okay, you have any
Can
other
I take him
concern?
to another hospital?
Uh, Again, Mr. John, I appreciate your concern and your worry. But we have to talk to Mr. David first. He has the awareness enough, and he's aware enough to take the decision. If he want to take, if he accept to take him another hospital. So let us sit with him first, and we will update you about the further plan.
Okay.
You have any other concern?
No, doctor, thank you.
Can I ask you some questions?
Okay.
With whom Mr. David living,
Okay, he's living with me.
and who's else dependent on him?
No one. I support
Okay.
him.
Do you need any support, Mr. John?
No, thank you.
What was his job?
Okay, he is retired now, but he was the teacher.
Okay, and did he smoke or he ever smoked before?
Yes, he was smoking, but now he quit.
Okay, that's good because also smoking might lead to this condition, and it might worse also this condition. Does he drink alcohol?
No, no.
Yeah, good also to know. Okay, you have any other concern?
No, doctor.
Okay, Mr. John, I will give you some
Oh,
leaflet brochures
okay,
and
time ended. Time ended.
okay.
Okay. You did well, really. You answered all the concerns. But only one concern, which transferring to another hospital, that will delay his treatment, and it will need some arrangement. So we will start to treat him, and we advise you to let him in this hospital to start to treat him. Okay, and about the feeding, yes, nothing per oral, because we need to allow the perforation to heal. And we will give him fluid and also antibiotic. And about the plan of management, the multidisciplinary team, okay, and will consult the surgeon and the gut doctor. And about the prognosis, if the surrogate asks, the prognosis is good. If it is a small perforation, it will heal within few days. Okay, and also don't tell. It is autonomy. We need to tell him, of course. I want to take him home. This could be difficult because we need to monitor him and give him fluid by IV fluid. Okay, and the condition is serious if not treated. Yes. Um, okay, and your father signed about the consent, and this is mentioned in the scenario that it has a risk. Even in the best hand, there is a risk of perforation about 5%. Okay, and you did it well and satisfactory in all.
Okay, thank you, Dr. Sarah. You are a good
Okay.
surrogate, really. You give me concern after concern till the time finished.
Yes, that's
Yes,
what
by the
should
way,
be. That's what should be.
yes, they will be like this. They will not give you
Okay.
chance to talk. Let them talk. Better let them talk. Because any talk or any sentence the surrogate saying is a concern. And you have to address it. So you
Yes,
fill the time, and it's good to answer the concern rather than talking all the scenario.
exactly. Exactly.
Okay, thank you, Dr. for the scenario.
Okay, thank you.
And we can open the discussion now. Or judgment from examiner, Dr. Mahmoud.
Dr.
Dr.
Basim,
Bassam,
you know my
Yes,
Dr.
yes,
Bassam, I just want to ask you some question.
yes, sure.
Doctor, your hospital is very bad. If your doctor does not know how to do dilatation, why your doctor did this dilatation? I want to take my father to another hospital because I'm fed up from your doctors. So what should be your answer?
Yes, I'm so sorry about your feeling. I appreciate also your concern and your worry, Mr. John. Uh, I accepted what you are feeling now, and we already had an action for what happened. Be sure that what we are doing for Mr. David is the best interest for him. However, this complication might happen even with the good and expert doctors. This,
No,
this
again,
uh-huh.
in in spite of all this, again I want to take my father to another
Okay.
hospital.
Yes. So uh, we will sit with Mr. As I said in the scenario, but Dr.
Yes,
Sarah
yes.
said also another answer. But for me, we will sit with Mr. David first. We will explain to him what happened with him, and he can understand and he can decide where he can receive the treatment or the management plan. And it's better to let him here until this perforation will be healed. This is the answer. It's
Yeah,
between.
yes. Okay, or you can add this word. Okay, if you want to take your father to another hospital, the protocol will be the same wherever you will take.
Yeah, yeah,
So,
this is another answer. Yes.
yes,
So
yes, you can.
I will
And the
talk
second
about the
answer
other
will be,
hospital, not about my hospital. Yes, you're right.
yes, 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 yes. The protocol will remain the same. If you will take your father to other hospital, so it's better in our opinion. He should stay here. so that we can monitor him minutes by minutes, and we will update you about his condition. As you
Yes.
told, that this complication can happen in any expert hand.
Yes, you're
So
right.
just I want to this add
Yeah.
from the surrogate side. Thank you.
Thank you,
You
Dr.
did
Azhar.
very well. You did very well.
Thank you, Dr. Azhar. Thank you so much.
Welcome. Welcome. Now, Dr. Mahmood turn.
Yeah, Dr. Mahmoud, Mark.
Yes, over satisfactory, Dr. Basil. Over satisfactory.
Wallahi,
That's my degree.
I will miss these comments after your exam. But you promise us you will join us. Inshallah. Thank you, Dr. Mahmoud. Any comment or any suggestion, any adding point,
I think, Dr.
any
Basim,
judgment? Yes,
you're
please.
doing very well. But my comment, I think when when surrogate or candidate, he said, or this next of kin, he said, I need to do like this. We need to ask him, can I know why I need to take him home? Can I know why I need to take him to the other hospital? Yani we need to ask him. We need to know what's the behind of this question. And
Yes,
always when he said like this, we need to ask this question. And I want to take my father home now, doctor. Okay, I appreciate your concern. Can I know why you not, why you need to talk home now?
yes,
Why you
yes,
need to talk hospital now? Regarding this, to take to other hospital, I'm sorry to tell you, this is your full right to take to other hospital, but taken to other hospital, we need arrangement. We need arrangement with other hospital, and your father condition now not stable to transfer now. Like
yes,
this, we need to say like this.
yes, yes. I agree also for this. But the decision also he should be taken by, or the decision should be taken by the patient, right? I cannot say this is your right. I can say this is the patient right.
Yes.
But
And yeah,
he is
yeah.
next of kin,
No, no. Even he's the next of kin. The patient has the right to sign and to decide, right? He's the one signed for the consent, unless he lost the capacity.
Allah, I don't know. But anyway, depends on
Yes, I
scenario.
agree to
Yes,
ask
yes.
about what the idea behind that. Why you want to take him? Yes, I agree for this. Totally agree.
Yeah.
But if he insists, by the way, this is a tricky point. If he insists to take him another hospital, and you are in a situation either to let him take or no, and he's insisting for that, it might be a trick if you agree without his father approval. You got it.
Yeah,
So
yeah.
don't, yeah, take care of this. He might tell you okay, and you will tell him okay, you can take him, and the father is
But
there. Why you didn't take for a decision from the father?
I yes, agree with you. But
Yes.
I see this. I mentioned this is as generally, not for this
Yes, as
scenario.
general,
I
I
say
agree. Yes, I agree. I general agree. Yes,
as general, yes, yes.
yes, agree. Thank you, Dr. Ali. Thank you.
طيب one concern, what about if the candidate, like, doubted about the presence of error? Because there is a perforation due to error, there is a perforation due to complication.
So
صح ولا لا? Both of them can
yes,
happen.
yeah,
So what if the patient told you that, doctor, has been done multiple times in the same hospital and there was no complication? Why this time the complication happened? What if there is an error this time?
Because this is an
yes.
unexpected complication. Unexpected, I think.
No, no, we can relate it to the situation. Okay, if there is an error, we will investigate about it and we'll update you about the result. If there
أنا
is,
totally agree with you. Never
yes,
ever say it's not an error
yeah. If he
لأنه
assume yes,
perforation.
mhm,
عن جد ممكن they investigate they found out no, there was a mistake by the team. They went inside, they did something whatsoever if he doubted about the presence of error, you should tell him that we will investigate, we can run an internal investigation about this, and if we found anything related to an error or anything that could have been done by mistake by the team, we apologize and we will come back and update to you.
Yes,
we apologize
you
on
are
that circumstances.
You
And
are right. You are right. And only in some scenarios they will put it clearly there was no error. But
Yes,
in like
exactly.
this scenario, you are completely right that there is a possibility.
there is always a possibility of error. والناس اللي كانت عم تعمل هذا السيناريو ما عرفت تجاوب على السؤال وضلت مصرة إنه complication. اللي قبلهم نجحوا، هدول الجداد ما نجحوا. على الأغلب عم بيقولوا كلمتك مزبوطة، إنه هي السنتنس إنه no error كان موجود بالسيناريوهات القديمة، لكن بالسيناريوهات الجديدة ما له موجود. فبالتالي وقت انسأل هالكونسيرن وضل السيروجيت مصر إنه it's a complication، كلهم خسروا السيناريو مع إنه عملوه بنفس الطريقة اللي نحن متعودين نعملها. تمام؟ فتيك كير، حتى بالفيدباك مكتوب إنه السيروجيت الكانديدate insisted that it is a complication and he denied the possibility of error. تمام؟ فتيك care, don't deny the possibility of error. Error are always there and can happen despite it can be a complication. I agree. There is a possibility it's an error. Your father, يعني الfather of this patient deserve to be investigated whether he get the perforation as a result of error ولا it was the complication which happened and the team didn't do anything and everything went smoothly, but unfortunately the perforation happened. So he deserved to be investigated. He deserved an incident report. He deserved an apology. تمام؟
How to
Especially
answer دكتورة هند يعني how to answer if surrogate يعني ask this
the
question
best
what
thing is the word، الكلمة السحرية اللي نحن دائما بننساها if. إذا إلك عنا حق حتاخده، هي. So since you are doubting there is a possibility of error, we will run an investigation through documenting or through our system. We can run some internal investigation which called an incident report, and it will be looked by a higher authority team. And if we found any possibility of mistake, shortcoming by the team, if we oversight anything, we will come back and update you. And I apologize if it was an error and if it caused for you and for your dad any kind of distress.
I think you are
did
right
good
in that,
work.
but we couldn't write an incident or datics if you are not convinced it is error. So the patient will go. If you think it is error, you can complain, and then the pulse liaison team will investigate it. But
There
for
is always two pathway. في
yes,
datics
but
اللي هو
for, if you
internal
are not,
investigation.
if it's a complication of the operation and the treating team that doesn't have doubt of error, they couldn't write datics or incident
طيب
track.
هذا هو اللي بدهم يفهموه منك، إنه هل أنت واثقة بنفسك أو بالتيم لدرجة إنه you don't want even to issue an incident report؟
We couldn't issue an incident report because this is a complication. So if the patient has doubt, because this patient has doubt, for us we don't have doubt. Because
خلاص أنا
if we
it's
have
up
doubt,
to you. It's
if
up to you.
doubt,
You will, if you get this scenario, send your patient to the pulse and tell him that from our side it's a complication. If you feel it's an error and it is something you want to complain, go to pulse.
if it's
لكن
doubt,
هذا أنت برأيك. أنا بصراحة I will never say like this لأنه from my point of view it's a kind of rude thing that
if
I
it,
will insist it's a complication because
دكتور
it can be an error.
okay,
It can be
دكتور
something happened during the operation.
دكتور سارة.
I was
if
not
Mm.
there
doubt,
during the endoscopy.
okay, if
Yes.
it's doubt in the scenario, it will be written that there is doubt or there is a medical error. So
No,
at this,
no,
have the right to write
it was like hidden agenda, Dr. Sarah. It will not be written in the scenario that the daughter or the son doubt
but
about
Will surprise
what
you
happened.
by this concern.
Yeah, he
He
can
is
should.
thinking it's an error. And you have to deal with it as an
Yes,
uncertainty because you are not the
yes.
one who did the endoscopy.
But if you apologize, Sarah, Dr. Sarah, sorry, and you said I will make instant report, like you are saying, no, acknowledge the mistake, and it
The
wasn't
team,
there. Sorry.
if the team thinks that
if
there is an error from the start,
Yes,
they will tell the
yes,
relative that
they
there is
not
an error.
wait till the
But
patient.
yes,
exactly.
yes,
So
Are
yes,
not
the,
waiting till
but
it is
now it is for the patient. If the patient has a concern, that means during that
yeah,
meeting, the medical doctor doesn't think that there is an error, but he will accept this approach is very good from the doctor mentions that, he will tell her that yes, okay, if you have a doubt, you can ask
Exactly.
for that,
Yes.
and we will do it. Yeah,
We are not
We will
volunteers saying it, Dr.
like,
Sarah.
exactly. You are right. Yes,
we
We
will
are replying to him only.
but because we are not able to do a datics, we usually are investigating and writing the datics if we have doubt from the beginning. If the patient
No.
raises concern, so he will raise a file complaint, so we will investigate according to that.
Yes, we are
yes,
What
responding.
I
We are
mean, but
responding to her. Yeah, we are
if
responding
the
to her.
patient is saying only I want to, I think it's error, so we couldn't do an incident report according to the patient.
No, we will not do insult.
We
We
will
just
okay, so we can say other thing. We'll discuss it with the consultant,
exactly.
check if there is error or no, or
Yes.
you can also file a complaint, so they will investigate about that, and
So
you
don't admit.
yes,
Exactly.
not
Don't admit.
not incident. We won't do
No,
incident.
no. Yes, exactly. We will not admit the mistake.
Say,
We are okay. Listening to you, we accept your point, but we will investigate just to be sure and to also to make you sure. That's it. You are not assuming there is a
we
mistake,
discuss
but
it, but not is a file make an incident or datics. This is what I'm saying. We
you
won't.
will do incident for what?
السؤال
No.
هلا أنا ماني فهمانة أنت ليه مصرة الانسيدنت ريبورت كانت بي دون؟ سألت كتير ناس بيشتغلوا باليو كي، الناس قالت لو ضاع الإسوارة تبع الفول الريسك اوف فول اللي
Yes.
موجودة على إيد المريض وي ايشو
Dr.
ان
Hind,
انسيدنت
Dr.
ريبورت.
Hind,
فوقتها
just to
كان
clarify.
الحوار إنه الانسيدنت ريبورت is a safe tool.
No, only to
Sometimes it's a
clarify.
reputational
It's
tool.
separate. It's doctor
Once,
It
decision,
will,
not
it can
patient
be
decision.
issued يعني.
sorry, incident report. sorry. If you go for incident report, that you admit a mistake, even
Yes.
small or big.
Separate
But
is
now,
a
if
doctor
there is no,
decision.
As you
if there
guys
is,
خلاص
Decision.
okay, don't issue an incident report يعني.
Yes, this is
yes,
only you are right in
no
everything.
place for incident report in this case, because if
Yes,
you go for incident
Yes.
report, that
yes.
means
I
you
agree.
admit 100% there is a
Exactly.
mistake.
Yes.
Yes.
We
أحيانا
want to
Nothing
الانسيدنت
go
ريبورت
happened
to the
بيطلع
bottom.
نتيجته إنه ما في error.
No, to
without
go to the
أحيانا
reporting.
bottom
بيطلع
and to
الانسيدنت
improve.
ريبورت إنه there is
No,
no error.
no, the
No,
incident
how we will
report.
admit something before investigating it يا جماعة.
No,
ما
you
الانسيدنت
investigate
report is
but
an
we are
how
investigation.
the error happened and how you can benefit from that error not to happen again. So
the,
if you don't you investigate only incident report, that means there is a mistake, but you want to go to the bottom of that mistake. So here no place for incident report.
yes.
Yeah, I
And the
agree.
incident report is medical decision, not patient decision. If the patient thinks that is the error, you are right in everything, Dr. Hind. But the only thing, we will do everything. We accept it. It can be an error.
Why there is no
But
possibility of error in this scenario?
it could be a
Doctor,
possibility, but the patient will raise the complaint and we'll discuss it with the consultant. We shouldn't say we'll make a datics or incident report, because this is
Excuse me.
that
Excuse
we
me. I
think
just
that
want to have one comment.
okay,
This
Dr.
is
Azhar.
clearly written in the scenario. This complication can happen in about 5% of patients. So there
Yes.
is no chance of error or mistake in this scenario. It's clearly written.
Yeah, it will be
Thank you,
written as a
Dr. Ansar.
mistake.
Yes, that's what I wanted to say. You need to trust the scenario. If it is an
Yes,
error, it will
and they
mention
will write for
clearly
you.
this is an error.
Exactly.
Yeah.
Yes. This is the this is the clear
This
cut off.
complication can happen in about 5% of
Yeah.
patients.
Yes.
Clearly written.
Yes. Yeah. So it will. This is the clear cut off. Any written words, believe on it. If they wrote
Yes.
this is error, go and follow the error steps.
طيب
If not,
سؤالي ليش
yes.
معتبرين هذا البيشنت من ال 5%؟ ما أنا في عندي 95% هدول they should not have the complication، وبركي هالزلمة
Okay.
هذا من ال 95.
Okay. If it
يعني ما
happened,
هذا سؤال كمان ممكن تسأله أنت لحالك؟
Yes,
صح
we
هو
agree.
خمسة there are 5% it's an error but 95% I'm sorry 5% it's a complication but 95% it's not a complication.
I have
Suppose
How
not to
I
happen.
decide this
Suppose not
patient
to
is
happen.
sorry,
from the
Dr.
other
Bassem,
percentage or not?
I have a comment. Sorry, I have a comment. Even write incident report, we investigate, no problem. But the fatal thing is telling the patient if you want to complain, you can raise complaint. It is a fatal mistake in the exam.
We will not
Don't
say that. We will not tell
no,
him a complaint. If he raise a complaint, if he raise the issue of I will complain, okay, this is your
بس
right.
هاد ما عم بيقول لك أنا I want to complain، عم بيقول لك if
Yes.
there is a possibility of error.
So yeah, we will follow it and we'll try to pick up what happened there and to find out what the problem. If there is any mistake, we will let you know. This is the issue because he raised this issue, but we will not do insertable because he's not a medical team field, or he's not in the medical team field. So why I will do insert report? It is not a mistake. If I do the error as or the insert report, it will be like admitting the error. We had a mistake. So we will just raise it to the consultant as this is a good suggestion. And if we will investigate about it, if we found that there is any defect or any something happened which is by negligence or whatsoever, we will deal with it seriously. If he raised
Yes,
this issue, okay, this is my point also. I think this is fair enough between us and the patient or the
yes,
So
relative.
and
if
just
you will
one,
take
one
it, if you will take the possibility of error seriously, and at least you mentioned the team meeting and you involved your consultant، بس يعني أنا على الأقل اللي بدي وصله إنه the patient might raise the possibility of error and you shouldn't insist on one possibility which is the complication. Whoever feel that he want to investigate, whoever feel it's enough to have an urgent meeting with the staff and the consultant, but at least don't insist that there is one possibility and that the scenario is going into one direction which is a complication. على الأقل من الفيدباك which I saw. It is just an advice, but I'm sure you people, everyone gonna read a different scenario and he will find some clues in the scenario which will guide him, and never ignore those clues. But at least you should know that once there was a scenario and there was a concern about the error and there was a comment on a feedback that the patient ignored the possibility of error. فأنتوا
We didn't.
هالpossibilities موجودة عندكم، تستخدموهم بالسيناريو اللي بيجيكم بالامتحان.
Yes, we didn't
لكن
ignore it,
finally
Dr.
it's your
Jahan.
decision how to handle it.
We didn't ignore it. We respect it and we will raise it. But why I will write incident report without any evidence? He is the one assuming that. I don't know what happened in the OR. He
أنا
doesn't know
كيف
also.
بدي أنا how I will get a results. Who will tell me؟ ما أنا لالي شخص ما بقدر أروح أسأل كونسلتنت اللي عمل الاندوسكوب قل له ترى أنا كنت مع البيشنت قبل 5 دقايق وقال لي إنه في ايرور، معلش نقعد أنا وياك تقلي شو عملت؟ أنا ماني الشخص اللي بقدر أروح to investigate. I
Uh,
agree maybe the consultant,
do
maybe anyone on the team, I will raise this concern. It's
okay.
up to them إذا بدكم أنتوا to leave it up to the team whether they will take it seriously or continue with the investigation. As you said, it's correct, not bad approach. إنه maybe if the consultant was convinced or after I meet the staff they decided to escalate it to the incident report, or they will tell that we don't want to escalate the patient's يعني his, or at least يعني there is no possibility of error as you said. بس يعني respect as you said, at least this
Yes,
is
yes,
I
we are
want to end
respecting it. Of course.
the end
This,
results يعني.
yeah, we are
إنه
respecting.
keep this possibility قائمة يعني there is a
Yes,
possibility of error.
we agree about this point. About the incident report, this is our debate. And how to respond to the relative. Is it by incident report or by written form or by just a discussion? Or if he raise it higher and he want to make a complaint, we will send him to the pals. If he insists for that, okay, this is his right. But the point to raise or to write incident report based on the patient assume this is our conflict. Anyway, let's cut the story short, not to discuss a lot
Yeah, just
about it. Yeah.
other comment for Dr. Mahmoud.
Mhm.
And he said don't tell the patient to file a complaint. No, in the contrary, if any patient has
Yeah,
any
if
doubt
he
about anything, you will see the patient. Are you doubt about this? Yes. Are you not happy with the management? Okay. Do you think that there is an error? Yes. So
no,
you have to guide him and tell him
no,
this is the
if
liaison office.
but
You can
but
file a
if he
complaint.
is if he
Dr.
insists,
Muhammad,
No,
if the
no,
patient asks you to talk in
without
detail,
insisting, Dr. Bassam. Here is I think that it is the patient
I
right or the
think
relative right.
I think
You advise him. Some patients don't
Muhammad.
know that
Is
there is a place where they can complain.
yes,
So you
yes.
will advise them in any hospital
If
there is a department of complaint, different from hospital to hospital.
okay,
That patient, I think,
I will I will answer this point, Dr. Muhammad. If
yeah.
you
So
بالعربي
if you
حد
suggest by yourself, you will be for the consultant like a
no,
troublemaker and
no,
helping
I will
people.
tell you, no, you will not suggest what I said, Dr. Basim.
Okay,
He said,
again.
if you feel the patient is not convinced about your story and he thinks that there is a mistake, okay, you have, and he has the right, you will tell him, okay, if you are not convinced with my story, that it is a normal complication and it is not an error, and you think that there is an error, here, this office is the liaison
But yes,
patient
yes.
service. You can go to them and you have the right to file an a complaint.
By the way, it will be task for the surrogate to say it. I want to complain. He will not wait for you to suggest for him if you are not convinced. He will be not convinced from the start, and he will insist from the start. I want to file a complaint. I want to file a
Yeah,
complaint
he's right.
until
Yes.
yes. So don't suggest it. He will do it from any by any way, and he will not wait for your suggestion. By the way, this is my reply about this point. Okay, particularly. So no worry about that. He will suggest it for you, and you will guide him. And you have to guide him to the pulse office. But to suggest it for him, what if you are not convinced? Okay, you can complain. Means that you are helping all families. Come here. You want to complain? Just to go to the pulse. Here, come here. You want to complain? Go to the pulse. No, we are waiting for them. Doctor, I want to file a complaint. Okay, this is your right. Okay, so don't start the system. Let him start it. This is my advice. You got
Okay,
it.
and if, for example, in the end, if he say no, I am not happy, I think there is a mistake, and he didn't
Okay.
mention at all. He didn't mention at all a complaint. So
Yeah.
you close your mouth. No.
If he repeat this point twice, means he wait for that. Clear.
Okay, that's what I told you. If you were not able to convince him
really
that,
Dr. Muhammad, this mistake fails many doctors. Really, believe me. Don't push the patient to raise the
Yes.
no, there
complaint.
is difference,
Really,
Dr. Mahmoud, between push
believe
the
No, no.
patient.
He's saying, Dr. Mahmoud,
no,
second time.
no,
You told
even
him.
If
yes.
you
بس
fail to
يعني
convince.
في كلمة حلوة لدكتور بونيكر إذا بتحبوا تسمعوا شو قال بهالمجال هذا بتحل
But
القضية
in
اللي عندهم
English,
انتوا الاثنين.
Dr. Hind, because Dr. Azhar with us, please
Yes,
make
I'm
it in
sorry.
English.
So
Okay.
Dr. Poniker, he really gave a very valuable comment regarding this. He said Pulse is an office to help. It's not an office to complain. One part of the offered help or offered services, help, guidance, a lot of services. One of these services is to issue a complaint. So when I have something, when I have a doubt, when I want to know who should guide me, I should guide this person to the pulse just to have a guidance. تمام? To get an information, to get brochures, to know about the system, to know about his rights. So when you will guide a person to pulse, you are guiding him to a helping system where he can receive help, where he can receive guidance. So if I will say آسفة ما كنت بعرف اسم الدكتور who was mentioning about that I should guide, yes, I can tell this patient that I can guide you to an office called Pulse where you can discuss your doubts and they will guide you to the proper pathway in the NHS, okay, for to get an answer for these doubts. ما بجيب سيرة الكومبلين. Whenever he have anything and he didn't tell me I want to complain, بس عنده مشاكل في أشياء, he have some problems, he have things it's not clear for him, I will guide to the pulse. Go there, ask them what you want. They will sit with you, they will understand your problem, and they will guide you to the proper pathway to get an answer for your doubts. If he want to complain, if he want this particular service of complaining, again, I will guide him to the pulse for that particular service which he requests for. But doubts, error, he don't know what is his rights, he's not satisfied. He might tell you, I'm not satisfied about the service, and I want to discuss this issue with someone. It's a satisfactory issue. Again, you will guide him to pulse. But at that time, you will not mention anything about the complaint because this particular service was not requested by the patient. So the guidance to the pulse is for the sake of guidance. Okay? You brought pulse for the sake of guidance. And I will share with you his comment regarding this particular part. So you can read it by yourself. Okay? So I
But
think
also,
this
yes,
solved
Dr.
the issue.
very good it is, but it is last weapon. But I think don't ever push the patient to raise a complaint. I am sure about that, Dr. Muhammad.
Yes,
No,
yes, never
yeah, she
mention it.
didn't push for
يعني مثلا
complaint.
لو this scenario the patient
Oh.
is thinking there is an error as Dr. Sarah want to tell him, she can tell him that if you have any doubt that there could be some mistake happen, I will guide you to an office where you can
Yes.
discuss your doubts with them and
Yes.
they can help you to clarify. لاحظ I mentioned my whole answer without bringing up the complaint.
Yes,
And
exactly.
it's
Any doubt, any inquiry,
yes,
any
they are a helping services.
yes,
They
yes.
offer help to any patient, help, guidance, explanation, whatsoever. It's not only complaint. نحن بأذهاننا, in our minds, it was connected. There was attachment between pulse and complaint. This link is wrong. Pulse is
Yes.
not offering only is not only
Patient advice, yes.
they offer advices, brochures, guidance, explanation, a lot of things. The idea is to guide them if the patient have a problem, but don't mention the word complaint, except if it is mentioned by the patient.
If not mentioned by the patient, and if it is the scenario, medical error. If the scenario is medical error, 100% to mention the pulse. If you didn't mention the pulse in this scenario, you will fail the station.
But
Agree?
why Dr. Basim pulse also? Medical error we didn't.
Yes, of course. Medical error, you have to mention the pulse. The patient will ask you many times, I want to file complaint. What do you think? And there is
Yes,
error.
if the patient complain also, even
Yes,
in
but it's your task to reach to this point. He will ask you definitely, and you have to answer it in this way. Okay? So if you didn't mention the pulse while the patient saying I have a complaint, you will fail because you didn't guide him to the assigned office. You got your point, my point.
yes, Dr. Basim, but if the patient also raise the complaint, if he tell I want to raise a complaint,
Any patient you mean?
هو قصده دكتور محمود إنه sometimes you are a perfect candidate to extend you can satisfy your patient despite there is an error, and because of your politeness and sympathy and empathy and your professionalism, the candidate was so happy to extend. He didn't ask to complain, and he was satisfied with your investigation and incident.
Yes, I agree.
This is what Dr. Mahmoud he mean, and those people are there. And they can really handle the situation very good, يعني, without reaching.
Yes, I believe on that. But believe me also, the surrogate will reach to this level and to this point.
Yes, هلا نحن متعودين على هالconcern.
Yes, exactly.
The answer of this concern is the same ancient time. So you repeated the same, that we will guide you to pulse and your treatment will continue the same irrespective of your complaint. Hey, Mahmoud,
Yes,
I agree with you.
And the mistake was unintentionally and so on. Okay, a good also comment from Dr. Ali. To be honest, scenario in exam very clear. Error or not? Yes, I agree also, 100%. Thank you, Dr. Mahmoud, Dr. Sarah, Dr. Hind. Very hot discussion again. I like this interactive sessions. Today, a lot of comments and interactions. I think all of us also learn a lot of points today. Dr. Azhar as well. Thank you, Dr. Ali, Dr. Muhammad. I hope I didn't forget any. Dr. Ryan, Dr. Najla. Of course, Dr. Mahmoud, our examiner, tough examiner.
Except you, Dr. Basim, except you.
Thank you. You will pass me, right?
Sure, Dr. Basim. Over satisfactory.
Over
satisfactory. Over.
20 out of 16. Okay.
Yes.
Okay, thank you, Dr. Mahmoud. Appreciated it. Thank you. Nas خلف الكواليس, yes, behind the scenes. Thank you. Thank you, everyone. Really, it's very nice session. I think this is the longest communication session ever. 1 and 45 minutes for 2 scenarios for 10 minutes each. But the discussion always helping and clarifying the points. And this is what we are learning from always. Thank you for attendance, everyone. Anyone has comment before ending the session? Any question? Any suggestion? Any complaint? Anyone to raise a complaint? I can guide him to Pulse office.
Sure, right, Dr. Basim.
Okay.
Okay. Thank you,
Thank
Dr.
you.
Muhammad. Thank you, Dr. Hind. Thank you,
Thank
Dr.
you.
Azhar.
Okay, waiting for your scenario tomorrow, Dr. Hamid. I prepare also another scenario for you. And for the last clinical day with Dr. Mahmoud, hopefully before the exam. And inshallah, in the exam, you'll do the best.
Dr. Basim, it will be interesting one, really.
Yes, inshallah. I know you bring
But it come,
محمود والله
come.
انت رائع بتسويق الاشياء. نحن امبارح عم
Yes,
بتذكر
yeah,
كلمتك.
yes,
It will be very interesting.
yes,
Really
yes.
very interesting.
And it's
You
the
will
last
see.
case, inshallah, Dr. Mahmoud, last case before the exam and after the exam. You will not do it again, or you will be just guest.
No, Dr.
Not-
Basim, I with you.
Yes, I
Don't
know,
worry.
but as a guest, I mean, you pass the exam and you will be like guest with us, not
Thank
that
you.
thing.
يا رب Dr.
Inshallah.
Basim.
Ameen, ya Rabb, Ameen. Okay. Thank you, everyone. See you tomorrow, inshallah, the clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.